Good evening, everyone. My name is Hethel Shah, and on behalf of the entire team here at Sigma, I am honored to welcome you to the first in a series of webinars being held in very different circumstances. As many of you know, at this time of year, we would normally be making our preparations for our annual Overseas Community Pharmacy Conference, but I hope webinars like today's will provide you an informed and opinion-driven perspective of current matters concerning independent pharmacy. We at Sigma are extremely proud to be part of the pharmacy community who have been integral in patient care during this pandemic. This has placed community pharmacy at the forefront of the government's agenda, including the COVID-19 vaccination program. We are therefore very privileged to have the Right Honourable Nadhim Zahawi, who we believe is speaking to the pharmacy community for the first time tonight, and will be available to answer your questions. And joining him will be Simon Dukes, CEO of the PSNC. But without further ado, I would like to introduce our host for today's webinar. Right Honourable Steve Brine is a Member of Parliament for Winchester and Chandler's-Ford. He is a former Public Health Minister and active MP, serving on the Digital, Culture, Media and Sport Committee and as Chair of the All-Party Parliamentary Group for Childcare and Early Education. Recently, Steve has raised questions in Parliament about the timetable for the reopening of schools and the plans to support those hesitant to take the vaccine. Tonight, he will chair our discussion to help us get the most out of the Minister's time. Can I please introduce Steve Brine, MP?
Thanks, Hassel, and good evening, everybody. Thanks for joining what will become a series of these Sigma webinars. They're called Taking Pharmacy Forward. And at the end of tonight's session, Bharat Shah from Sigma will give a few more details of where we're going to go next with this. But tonight, obviously, there is only one agenda, and that is the continuing battle against COVID-19 and the brilliant world-leading rollout of our vaccine program. Now, there are two people who are here tonight, who obviously Simon Dukes from the PSNC, who many of you will know, and Simon, who I worked very closely with when I was in office, and such a refreshing new broom at PSNC when he took over what must seem like a lifetime ago now. But welcome, Simon. We'll hear from you in a minute. And also our special guest tonight, my good friend Nadhim Zahawi, MP, who we were elected together in 2010 to Parliament, which seems like many lifetimes ago now. He's the MP for Stratford-upon-Avon, a really good friend, a business minister who was asked by the Prime Minister once we got together a vaccine rollout programme to be our vaccine deployment minister. And it is probably the sort of job in government that many people would say, goodness, who'd want to do that? But you know what? He's made it his own, and he is absolutely up and sprinting. And we look good for our 15th of February deadline to vaccinate cohorts 1 to 4, and we're absolutely thrilled that he's here with us tonight. Minister, welcome. Sigma, taking pharmacy forward. If you could just sort of open up a few remarks for us, 5 to 10 minutes, giving us some background of what you're doing, you've got well over 300 wonderful community pharmacy here online this evening. I think a couple of things they'd really love is the latest figures, obviously, and how we're doing with those frontline health and care workers as we get Monday's deadline. So you have Nadhim, welcome, and thanks so much for joining us.
Thank you so much, Steve, and Havel, thank you for hosting this. And of course, it really is delightful to come and be with you, and to also share a platform with Simon Dukes, who I know is doing a tremendous job in his work, speaking for the community. I guess from where I'm sitting, I want to one, thank Steve Brine for this invitation, and of course Bharat Shah, the co-founder of Sigma as well. But I also want to recognise the immense contribution being made by you, the community pharmacy teams, especially in these truly unique and exceptional times. Your work is critical to the safe care of, obviously, patients. Community pharmacies really are the local lifeline for patients and the public. Pharmacy teams have absolutely stepped up at this crucial time, providing vital services to the population. Right at the start, you were very quickly out of the stalls and adopted the COVID-19 secure practices while remaining open, supporting anxious and worried patients. You've made a direct contribution with the medicine delivery service for shielded patients and by taking part in the biggest flu vaccination service we have ever seen. And on the 15th of February, a brand new discharge medicine service will start on the same day when I hopefully be able to declare that we've met our target that Steve referred to, and I'll say a bit more about that in a moment. But that new discharge medicine service will be providing, it'll be provided by all community pharmacies, forgive me. This focuses on helping patients who come out from hospital with their medicine regimes. The aim is simply to prevent problems and reduce hospital readmissions, which is more important than ever at this time. As you probably have heard me say, I believe that vaccines are the way out of this pandemic, and they are making us all more hopeful every day. The COVID. Mike, can I ask you to go on mute because I'm getting a lot of background noise from your setup? Thank you, Mike. The COVID-19 vaccination program is the biggest vaccination program in NHS history, and we've protected more people through the vaccinations today than all other countries in Europe put together. Across the United Kingdom, we've now protected over 13 million people, almost 1 in 4 adults in the UK. That includes over 90% of people aged 80 and above, almost 96% of those aged between 75 and 79, and over 77% of those aged between 70 and 74, who were the most recent, of course, group to have been invited. And looking at those particularly vulnerable care home residents, we've also vaccinated over 93.5% of those who are eligible. And of course, some tiny minority who are infected will go back within 28 days and vaccinate them as well. NHS staff are delivering the COVID jabs at a network of more than 1,600 vaccination sites provided by hospitals, vaccination centres, and of course, GP and community pharmacy-led sites. It has been challenging to set up so many vaccination sites, no doubt, because obviously the logistical difficulties, as Brigadier Prosser at one of the press conferences referred to, it's a bit like standing up a supermarket chain in a month and then growing it 20% every week, including obviously vaccine transportation within time constraints and providing sites all the other equipment, because it's not just the vaccine they need to operate effectively. However, I think we've made a phenomenal progress. Only 9 weeks ago, we were literally just starting out with the first few hospital hubs delivering vaccine. And for that, I'd like to thank Community Pharmacy for putting yourselves forward for the COVID-19 vaccination services, commissioned obviously by NHS England and NHS Improvements as a local enhanced service. I went to one of the pharmacies, Steve, to roll out the vaccine, the Cullimore Chemist in Edgware. It was so heartening to see this thriving but really well organised service due to the exceptional work of their team. And I'm delighted that we now have almost 200 community pharmacies who are helping us with reaching our goal to vaccinate those in cohorts 1 to 4 by mid-February. I think we've done over 350,000 jabs in community pharmacy. As you'll all know, we are well underway to reaching that target, and I'm grateful to all of you who have contributed to that. It is an incredible achievement by everyone, who are involved in this, including, of course, community pharmacies, especially because the service is not as straightforward as one may think. It is its challenges with setting up the pharmacy vaccination sites, including onboarding it into the national booking service. As you all know, the vaccine also poses a number of challenges, from storage to packing. It comes in multi-dose vials, and you will absolutely understand the challenges of drawing up the unpreserved vaccine, especially aseptically, immediately before each use, and the timescale for administration once the multi-dose vial is punctured. So a lot of intricate detail. There's also been some exceptional and innovative models provided by community pharmacies to maximize vaccinations. Just to give you a quick example, we had a team of 22 community pharmacists in South Tyneside have been vaccinating housebound patients and carers on the weekends who find it difficult to leave the house as part of a new local scheme. And in Bedfordshire, rather than a PCN, we have 3 community pharmacies providing the vaccination service to the local population in cohorts 1 to 4. And even where pharmacies are not providing the COVID vaccination themselves, community pharmacy teams, as trusted members of the local community, have a vital role to reach out to their local populations, to encourage people to get their vaccinations, and of course in answering those questions from those who have questions, who are unsure about the vaccination for themselves. We know that some communities are more hesitant about a vaccine for a range of reasons, and sadly many of these groups were disproportionately affected by the first wave of the coronavirus. We know that community pharmacy can reach into those often hard to reach groups. So I really want to work with community pharmacy to keep driving take up of the vaccine, because ultimately we want to protect everyone we possibly can as quickly as we possibly can. We're now looking ahead towards vaccinating those in cohorts 5 to 9, and I can assure you that community pharmacies' involvement will continue to be crucial. For these next cohorts, most pharmacies are expected to be involved where there are geographic and capacity gaps in service provision. There will still be the practical and logistical issues, of course, I referred to earlier. So the NHS will be using the same local enhanced service commissioning route for the next phase. In the longer term, NHS England and NHS Improvements are also working with community pharmacy organisations on future commissioning of the service beyond 1 to 9. The ambition is for the service to be commissioned from a significant number of pharmacies. However, there are a number of issues which need to be addressed before this could really happen. And just to give you an example of that, obviously ensuring technical capacity and functionality, clinical waste and collection and disposal, and access to additional products which are required to run the services apart from just the vaccine itself. I'd like to just end by thanking all those involved in the discussions with NHS England and NHS Improvements and for your contributions. And once again, I'd like to take this opportunity to thank all community pharmacy for stepping up to the enormous Herculean, I think Steve once referred to it on one of our conversations, task that the country faced, supporting patients throughout the pandemic. I'm really grateful for you inviting me tonight, and very happy to take
you, Minister. Thank you so much. there are loads of questions coming in, as you can imagine. The pharmacy community is busy tonight, and there's a lot of people on the call. We won't get to them all, but what we will do is hear from Simon. I just want to be clear, we will be focusing on the vaccine rollout tonight and pharmacy's role in that. Nadeem is not the pharmacy minister, he's the vaccine rollout minister. There will be future Taking Pharmacy Forward events when we will be talking about the wider issues, when Simon will no doubt be involved with that. But Simon, just a few words from you, just to frame, how you see it and the conversation that you've been having with Nadeem and Joe Churchill.
Thanks, Steve. Thanks, of course, Sigma, and also thank you, Minister. I'm really pleased that so many pharmacies have got sites up and running, and they seem to be, give or take, they all seem to be running very well. I think the message I would give is that we have the potential for thousands of pharmacy vaccine sites, not just hundreds, of course. And to this end, the pharmacy sector has come together and worked up a proposal whereby we think we could offer over 1,000 pharmacies doing 400 or so vaccines a week, and many thousands, possibly over 5,000 pharmacies doing 100 plus vaccines a week. And I know this will not be for every pharmacy, just like flu, in fact, is not for every pharmacy. But I think the point is that the sector is keen to help. Steve, I know you get this across from your pharmacy contacts, and I think we do very much as well, that pharmacies see themselves as very much as part of the NHS, and they want to do their national duty in getting the nation out of this crisis. I was at an impressive COVID vaccination site at Lincoln Pharmacy in Poplar on Monday in East London. And saw capacity still there to offer. And clearly the numbers of patients slowing down as of patient behaviours, the competition with GPs, the competition you may well touch on some of your questions, but partly also supply, and the fact that it was coming to the end of some of those 7 cohorts. So I suppose when really say, well, what's next? And I think what's next? Pharmacy has a great role to play in reaching some of those, if I can use the term, vaccine hesitant communities. The pharmacy, Lincoln Pharmacy, told me of a great story of a patient from the BAME community who came into the pharmacy because she always came into that pharmacy. She felt comfortable there. And insisted that her vaccination was filmed so that she could put it on social media and underline the importance of vaccine to her community. And I think it's a fantastic story showing how community pharmacy has a real important part to play in this. Also, and of course this would have to be a policy decision, Minister, but why not let pharmacy vaccinate some of those non-health related cohorts, law enforcement, bus drivers, teachers, all of whom, of course, could be specifically invited to a community pharmacy and have got ID to show who they are, which might make it easier for the process. And of course, whether or not a pharmacy is involved in the vaccination itself and vaccines itself, they have a role to play in reassuring patients. And I know up and down the country, they are answering questions about not just COVID-19 itself, but also the vaccine. Finally, I would add that whether a pharmacy is flat out or at maximum capacity, they are incurring costs in setting up vaccination sites, and not getting the throughput does make them financially unviable, and we cannot, of course, subsidise this or any other part of the NHS work that we do. So finally, the sector is ready, waiting to do its national duty. Minister, let's open up all those other cohorts, the 50 plus, get them to use the National Booking Service and get them to have their vaccine at the most convenient location to them, which will no doubt be a community pharmacy.
Thank you. If you could make sure you mute Simon and Minister when you're not speaking, as I will as soon as I've finished introducing the first question. Make sure you mute Simon, please. because it's causing a feedback that people are hearing on YouTube, unfortunately. So anyway, sponsors privilege. Bharat, you get a couple of questions that you would like to ask the Minister on behalf of the community.
Hello, Minister. The question that I would like to ask is, now you have almost 200 sites running. How many more pharmacies are planned in the current wave?
Thank you very much. Can everyone hear me?
Yeah.
So you're absolutely right. We've got just shy of 200. We'll have 200 by, I think, the middle of this month. And we want to then look at the next phase. The limiting factor remains vaccine supply. And that's why we have, up until now, as Simon quite rightly just described, have gone with the 1,000 vaccinations a week as our sort of determining position. We will, in the next phase, look at, back to Simon, sort of linking it to your question, sir, phase 2, ask the question of the JCVI as to what the prioritization should be, and should we be looking at, and we'll ask them that question, different cohorts through their, whether it's teachers or police officers or shop workers, through their work, would come into much greater contact with other people and therefore much greater volumes of the virus, and should they be prioritized? And I would begin to look at a phase where we are no longer looking at, and it equally applies to BAME, of course, communities. We're no longer looking at only having sites that are, within 10 miles, anyone being within 10 miles of a site, vaccination site, but the convenience of pharmacy and the ability of pharmacy to be able to reach those hard to reach groups is something that we are also looking at. But the limitation at the moment is not the infrastructure, it's not the sites. We've got enough infrastructure to deploy. It's the vaccine supply that's the...
Thank you very much. Well, my next question is almost flowing from the last one. What are the plans for including pharmacies, more pharmacies in the next vaccination program, especially the pharmacies who had not applied in the current wave, and they are now interested in doing the vaccinations?
No, absolutely. And obviously, NHS England and Improvements are working with regions to bring on more pharmacy sites and to plan for the future of the programme. And this will inevitably involve looking at how to bring on pharmacies, including those who didn't apply in the first designation process. This will also be obviously dependent upon what I've just described to you, which is vaccine supplies, amongst other things. But that's very much part of the work that NHS England and Improvers are undertaking at the moment in terms of, with the regions, bringing on more pharmacy sites and into sort of that planning for the future of the programme. Including, by the way, as the Prime Minister quite rightly spoke about today, and I did last weekend when I did the Sunday press, we're probably going to enter a world of a booster jab in the autumn, and then an annual COVID vaccination programme, as well as a sort of flu vaccination programme.
Thanks, Nad. And thanks, Bharat. Okay, Rikin, who, Minister, you may not know that, but recently awarded Pharmacy of the Year at the Pharmacy Business Awards. Rikin, over to you.
Good evening, Minister.
Good evening.
I've got a couple of questions for you. First question is, I think you touched on this earlier in your opening statement. Is there a way of a number of community pharmacies working together and sharing their resources to set up a large vaccination site, such as a town hall site with plenty of parking? If so, where do they go? How do they set this up? Who should they be not asking?
Yeah, absolutely, Rick. And of course, there is a way of doing that. And actually, that pharmacies have already done that. We already have an example of more than one pharmacy collaborating with others to provide a vaccination service. One contractor is signed up to locally enhanced service and works with others then to deliver that. We also have examples of pharmacies collaborating with PCNs. Well, and we would absolutely encourage collaboration and for those to come forward and talk to us at NHS England and NHS Improvement, and that is very much part of the plan.
And my second question is, pharmacy-led vaccination sites are relying on the national booking system to send through patients. At present, only the over 70s and clinically extremely vulnerable are able to book in. My colleagues at pharmacy-led sites, especially in London, are finding it very difficult. They've got vaccinators ready, staff, volunteers, plenty of vaccines sitting in the fridge, but no patients booked in. For example, today we had capacity to vaccinate 200 people at our site, but only 20 appointments booked in through the national booking system. We've seen PCN sites being able to move into the next cohorts a lot quicker than pharmacy sites, with some vaccinating all over 50s, especially in London. The national booking system is holding us back from vaccinating patients, unfortunately. We've got patients that are desperate to be vaccinated at the pharmacy, and we're having to turn them away despite having the capacity. Patients cannot understand why we cannot vaccinate them, even though they've been sent a text from their GP inviting them for a vaccination. Even when the next cohort opens, hopefully next week, most of the over 65s locally have already been vaccinated. What is being done to address this?
Thank you very much for that, Rick. So the same cohort prioritisation, Rick, is in place for PCNs, community pharmacies, hospital hubs and vaccination centres, albeit via different booking systems. You're absolutely right. Where GPs have Pfizer vaccine that is nearing expiry, there are exceptional circumstances where they can go to the next cohort. No pharmacy receives Pfizer vaccine. We need to obviously really make sure, especially in the coming days, that we've offered the vaccine to all those in the priority 1 to 4 cohorts. And we think pharmacies can really help in communities where vaccine hesitancy, we heard it earlier from Simon Dukes as well, is an issue. And very soon, imminently, we'll be moving down the cohorts anyway. And that brings in millions more people into, if you just take cohort 5 and 6, it is massive. And so, I think you're not going to be short of bookings imminently.
Okay, Hatal, over to you.
Hi, good evening, Minister.
Hi.
My question is on behalf of the Pharmaceutical Wholesalers Network and as a member of the Healthcare Distribution Association, who have been involved in distributing vaccines to approximately 1,500 sites so far. We as a cohort have been classified as essential workers throughout the pandemic and have continued to maintain the medicine supply chain without interruption. Is there any motion? I know you've touched on it briefly with police officers and teachers, but is there any motion for our staff base, especially delivery drivers who are visiting multiple premises on a daily basis, to be considered in the upcoming cohorts of vaccination?
Thank you for that question. Look, we set the exam question to the Joint Committee on Vaccination and Immunisation to allow them to go and look at cohorts that were whether it's BAME or different professions, and they looked at all of that, obviously helped by the Office for National Statistics and some of their work in terms of the evidence, and they fell very clearly on the side of the 1 to 9 categories, very much based on age and then clinical need. So those who are clinically extremely vulnerable in category 4, category 6, which will be those with underlying other ailments. That is a very large category that we're about to begin vaccinating and protecting. That's the 16 to 64-year-olds. And then it's pretty much age-based, based on the evidence. Of course, we will ask the question in phase 2 as to what should be our priority, again, to the JCVI, and they will come back to us, and we will then begin that process. And we will ask the question about cohorts that, through no fault of their own, other than their profession, their work, may come into much greater contact with the virus than others, and we will then respond accordingly to the JCVI instruction.
Okay, thanks, Nad. So we've got lots of there, it's muted, please. We've got lots of questions from our friends in pharmacy media who are online tonight. So two from Pharmacy Business, one for you, Simon, and one for the Minister. Given the rising levels of vaccine scepticism within BAME communities and the trust that is placed in community pharmacists and their easy accessibility, how can we, Nadeem, make better use of community pharmacy to address these fears, given that they are in the heart of communities and have their trust? This must be a key point for you. And then, Simon, you can just sort of go one after the other. What discussions have you had as a PSNC with Joe Churchill and with the government about community pharmacy's role and the network's role in the future rollout of vaccine? First to you, Ned.
Thank you very much for that question. I mentioned it in my opening remarks. Community pharmacies, and I saw it, with my own eyes, albeit in an independent pharmacy in Edgware, where you could see how embedded in the local community. It took the pharmacist about 4 days to get his site up and running, set up a sort of call out on social media locally, brought the volunteers on board. Incredible coming together of pharmacy, dentists, nurses, all the whole ecosystem, if I can describe it as that, coming together. What we want to do more of is make sure that community pharmacy who are vaccinating, and that's wonderful and brilliant, but actually all community pharmacies should be able to disseminate some of the information that we're providing in 13 different languages, from Arabic to Farsi to Hindu, across the network, because actually they are a trusted voice in this endeavor. And I'll be saying more about our uptake strategy in the coming few days to reach those hard to reach groups. But the community pharmacy will play an important role in making sure that actually happens.
On your other question, Steve, of course, the vaccination is a local enhanced service. Nevertheless, we are PSNC discussing with NHS England about future commissioning of vaccine rollout beyond cohorts 1 to 9. I think it's fair to say there are, of course, practical issues, technical capacity issues, some of which the Minister has touched on. But yes, absolutely, those discussions are ongoing.
Yeah, and I answered a question, Nadeem, from Kirit Shah about languages, and you answered that brilliantly, so thank you for that. And then a question from Chemists and Druggists, so C&D, which many will know and read. Can you clarify your comments about not wanting COVID-19 vaccines to, quote, just sit in community pharmacy? What evidence is there that phasing the rollout through mass vaccination centres will result in a higher or quicker uptake of the vaccine rather than use the entire community pharmacy network, which act as local healthcare hubs. I mean, you've partly answered that, but the just sit point, which I know you obviously is not what you said tonight, but what I've said in the past.
Thank you for that question, and it's really around community pharmacy and the network, more around vaccine being, at the moment, supply being finite, and when you have supply that is finite, you've got to make sure the throughput is there for you. So the 1,000 doses a week is a deliberate part of the strategy at the moment. And there are, and I addressed them earlier, and Simon just referred to them, there are logistical difficulties with having all pharmacies as vaccination sites, including vaccine transportation within time constraints, and of course providing sites with all the other equipment they need to operate effectively. And so it's more about that. As we get millions more doses coming through in the weeks and months to come, and Simon has heard me say this before, as has Steve, it then becomes about reach. And I think community pharmacy has tremendous reach into those hard to reach communities, and convenience. And again, you tick both those boxes brilliantly, which is where I see our sort of the next iteration or the next chapter of the story heading towards.
And on the next chapter, I mean, when I was holding the public health brief in government, I mean, every year we would look to see what happened in Australia, and then we would tweak the flu vaccine accordingly, and then we'd order what we needed, and that's what pharmacies would then be advised by NHS England to order. Obviously, that it is more than likely that is going to have to happen going forward in the longer term. This is obviously a coronavirus as well. Is it likely that there'll be a separate division within Department of Health and Social Care, or a permanent separate minister with this remit? What sort of discussions have you had about that?
So at the moment, I think it's probably too early to say, Steve, in terms of what I would call business as usual, where we would be at the moment. The plans are two-pronged. One is the immediate deployment of the current vaccines, which is going well. We still need to hit that target of Sunday night, Monday morning for the offer for the 1 to 4 categories, and then move to 5 and 6, and of course 7, 8, and 9, and then phase 2. But I would just spend a couple of minutes just describing to you the second prong of the strategy is then giving us sort of future-proofing the vaccination program, and that has three strands to it. One is we're talking to all the suppliers currently, because they all have plans for improving their vaccine variant to deal with the virus variant. Two is looking at our current capability. So when the Prime Minister visited Valneva in Scotland, we announced an additional 40 million doses from Valneva for next year, for 2022, because that is the Valneva technology is a whole inactivated virus, and so we hope that vaccine is one that will be effective on any mutation that the virus may move in whatever direction. And if it's not, we have the relationship and the manufacturing capability to be able to adjust accordingly in the way that the world does to flu vaccines at the moment. And the third element of that, which is this new messenger RNA technology, of course, we're talking to the current manufacturers, but we've also struck a deal with CureVac, which is one of the leading messenger RNA companies, where they will work with us. And the attractiveness of the United Kingdom to them is our ability to sequence. You have the genome sequencing heft of the United Kingdom. We account for just under, I think, 50% of all vaccines, viruses that are sequenced at the moment, virus mutations that are sequenced at the moment globally for COVID-19. The combination of their messenger RNA with our sequencing capability will allow us to produce any vaccine that is required for any virus mutation and then rapidly manufacture it in the UK. And so I think we're going to enter a world, as the PM described today, of probably a booster jab in the winter, working with the current manufacturers or with the mRNA technology I've just described, and then an annual or biannual vaccination program of COVID in the way we do with flu.
Thank you. We talk about money. Lots of comment, lots of questions. One rather summed up by this: the government are paying GPs £10 to vaccinate the hardest members of the community to reach. Surely community pharmacy should be the first port of call for this role. What is the dynamic, Nadeem, around money paid to primary care as opposed to money paid to what I used to call pre-primary care in community pharmacy?
So where community pharmacies are going into the hard to reach groups like care home, where the local commissioner asks them to, they are also paid the £10, but obviously the service offering is at the discretion of the local system. That's probably the difference here.
Question from Graham Phillips, who I know well, and many will, is a very active community pharmacist in his community and on social media. He said, Nadeem, with respect, we don't doubt ministers recognise community pharmacy, but the NHS clearly doesn't. What's been your experience as somebody new to community pharmacy family, as vaccine deployment minister, of talking to the NHS? Is this a moment when community pharmacy can really do what we've all known forever, which is just prove its worth to the NHS? Yes.
Well, I have to say, and I spent 10 years of my life before entering Parliament with you, Steve, way back in 2010. Before that, in a business that observed human behaviour and reported on it, YouGov. And I have to say, my observation upon given this remit by the PM is that the NHS had already embedded community pharmacy into their thinking and also into the operation. So when they were standing up primary care networks, a number of them had community pharmacies within them. When they were taking me through what the proposals were of how we're going to stand up this deployment infrastructure, community and independent pharmacy were very much part of that planning process. So I am relatively new to this portfolio, but I can say to you that I don't recognise that sentiment, and maybe that's a good thing. That it is I hope no longer there, if it ever were. But at the moment, community pharmacists are doing a phenomenal job, and as I say, not least proving their capability of. And this is the exam question here. This isn't just about volume; it's about volume and precision targeting. And I think community pharmacies have a real role to play, not just in cohorts 1 to 4 or 1 to 9, but beyond that as well.
A question from Amit. Pharmacists are in a great position to complete yellow card reports for adverse effects. Can we encourage this for getting the MHRA data up to date? Good point.
Very good point. I wouldn't argue with that.
Yeah, if you could take that one, that would be great. Question from Sanjay. There's a real need in South London. Bit of a conversation by the sounds of it going on with local GPs. Can you sign off the Sutton site, please? We can deliver 4 to 5k a week. Bit of homework for you there, Minister, around the Sutton site.
Can you send me the details after this? I'll take it offline. Very happy.
We will. Yeah. To you, certainly. Simon, the GP and the pharmacy contract for the delivery of COVID vaccines is very, very different. This question from Amit says the GPs can flex cohorts with the authority of local commissioners, whereas community pharmacies' hands are often tied through the local networks. This rings. You're nodding. This rings true. Thoughts?
Yes, and I think I touched on that in my opening few words, that what we're seeing, and again touched on by one of the questions, which is that GPs have and are contacting their patients in different ways, perhaps by text, getting those patients to come in for a COVID vaccine, and almost bypassing that booking service. And it means then that, of course, that we end up with the situation that you've described, which is about having vaccine appointments being missed. So yes, there is that, and I think that opening up some of those other cohorts that the Minister touched on, and getting them through the booking service in particular, will help to alleviate that issue. And there's capacity there right now within community pharmacy. I'd like to see that capacity being used for that purpose, and I'm sure if that was the case, the capacity wouldn't be there for much longer.
And then while you have the floor, so another question from Pharmacy Magazine for Simon. We've talked a bit this evening about an annual boost, as with flu, which is let's face it, possible. Have PSNC put together a proposal for pharmacy's potential role in this?
Well, at the risk of repeating myself, it goes back to what we were saying earlier, that we are having those discussions with NHS about looking at the COVID vaccine beyond cohorts 1 to 9. And I think there's not an awful lot more I can say about that. I think partly because the NHS itself and Minister, I'll get your view on this, but they don't know exactly themselves what shape that will take, what that will look like. This is a bit of, as it was said to me the other day, like painting the Forth Road Bridge. You need to keep going and going and going, and so I think there will be clearly plenty of demand for COVID vaccines, and community pharmacy is well placed to deliver.
Okay. You didn't want to add anything on that, Nad? I think you've covered that quite a lot, haven't you? Question from Parish: why not let community pharmacies do the second doses while the first ones continue to be done by the big sites? As a thought.
Sorry. So you're just saying bring on new pharmacies just to do second doses?
Do the second doses.
Well, I go back and say to you, at the moment, the infrastructure that we've deployed is capable of utilising all the vaccine that I've got coming in. It's the vaccine supply that is the limiting factor. So it's not more sites that we need. I need to get more vaccine coming through. That is the bit that is limiting and finite.
So we got that. We get it. Strand Pharmacy. Question about the gap between the 12-week gap. Now, obviously, there's been a lot of talk about this. This must be a question that you get asked an awful lot. Just can you reassure everybody that we're absolutely in the right place there? We're following the science. We're following the evidence, and WHO are now in a good place on this as well with us.
They are very much. And it was great to see the WHO today. By the way, as well as the EMA approving Oxford AstraZeneca for all age groups, but WHO obviously looked at that as well as the dosing interval. And it's well worth reminding ourselves that Pfizer-BioNTech, which is the other vaccine that we're deploying, they themselves say that it is up to the national regulator to decide the dosing intervals, and the MHRA, as well as the Joint Committee on Vaccination and Immunisation, and the 4 chief medical officers of England, Wales, Scotland, Northern Ireland. So this is really not political in any way. All agreed that the right thing to do is to move to a dosing interval of up to 12 weeks. We are already beginning to reserve second dose for deployment for March. And so anyone who's had a Pfizer-BioNTech vaccine will get a Pfizer-BioNTech second dose. Anyone who's had an Oxford AstraZeneca first dose will get an Oxford AstraZeneca second dose.
Thank you very much. So I think the message we've got very loudly from you tonight, Nadeem, is a message of thanks and great. Thank you so much for the clarity around what you've been able to say. I mean, obviously, as normal NHS services come even more back online, our wider primary care family is going to struggle, and community pharmacy stands ready to help as and when you want it. I think and when you're able to do it with all the rate limiting factors that you have. So we know you've got a million and one other things to do to meet your Monday deadline. We don't want to hog you for any longer, but we're just going to hand back now to Bharat Shah at Sigma HQ, our sponsor for tonight's event, who will say a few closing words. Thank you, Minister, and thank you, Simon.
On behalf of Sigma, I thank Right Honourable Nadeem Zahawi, Mr. Simon Dukes, and Right Honourable Steve Brine for conducting today's webinar. I wish to announce that our next webinar will take place on Tuesday, 30th March at 7:30 p.m. with Lord David Pryor, who is Chairman of NHS England, together with Mark Lionette, CEO of NPA, and Steve Brine, again in a very similar format. Thank you all for logging in today and attending our webinar. I hope you have all enjoyed today's webinar and found it useful. Good night.